Dr. Amalia del Riego, a dual national of the Dominican Republic and Spain, has traversed the Caribbean. Her exemplary deeds in the fields of HIV and health are well known and highly acclaimed by professionals and practitioners. Her attachment to the Pan-American Health Organization for more than 2 decades provided the context and impetus for her first engagement with the processes of health reform in the Americas. With duty stations in her native Dominican Republic, Belize, Turks and Caicos Islands, the Bahamas and Trinidad and Tobago, and with portfolios covering a wide area of responsibilities, she interfaced with governments, academics and practitioners. This allowed her to champion the cause of equity and health, which she describes as her guiding principle. This guiding principle is the philosophical foundation upon which Dr. Del Riego encapsulates the range of her assignments in epidemiological research, in health systems and services, and in technical cooperation for priority public health programs. As HIV and AIDS advisor, she interfaced particularly with national AIDS programs and the Caribbean Regional Network for People Living with AIDS. She argues with passion that systems and models for health and development must aim to increase access, especially for the poor and vulnerable, and must remove the barriers that contribute to stigma and discrimination, especially for people living with HIV and AIDS. Dr. Del Riego was among the first set of professionals to be visibly involved in developing and coordinating the implementation of UNAIDS 3x5 initiative throughout the region. She championed this initiative designed to increase the number of people living with AIDS on treatment and argued assiduously for its incorporation as a priority in the PANCAP Caribbean Regional Strategic Framework 2002-2006. A dedicated member and supporter of the PANCAP partnership and its work, she never hesitated in responding to calls for provision of technical support and guidance to the PANCAP Coordinating Unit, the hub of the partnership. Dr. Del Riego worked closely with the PCU to convene the First Partners Coordination Meeting, which aimed at improving collaboration, harmonization and accountability among the regional support agencies responsible for achieving the objectives of the Caribbean Regional Strategic Framework. This was a turning point for the PANCAP in its quest to harness its resources towards greater impact on the programs of respective countries. As a member of the Priority Areas Coordinating Committee, a subset of the PANCAP Executive Board, Dr. Del Riego worked tirelessly to advance the mission of PANCAP and to assist with the mobilization of resources to implement the Caribbean Regional Strategic Framework. This graduate in medicine, who subsequently became a professor in epidemiology and preventative medicine, coordinated the Masters in Public Health program at her alma mater, the Autonomous University of Santo Domingo. She also explored the field of health economics at Aberdeen and Johns Hopkins universities. We therefore enthusiastically applaud a consistent voice for reducing the inequalities in health and in particular those suffered by women and children. It is with gratitude that we acknowledge her dedication and engagement in the crafting of both iterations of the Caribbean Regional Strategic Framework. It is with pride that we hail the outstanding achievements of a respected researcher and valued practitioner. It is above all an honor and a pleasure that you, Dr. Amalia del Riego, have agreed to accept this award as a token of PANCAP's appreciation for your outstanding contribution to the fight against HIV and AIDS in the Caribbean.